Greetings, Newark. My name is Amina Bay, and I am the councilwoman for the Central Ward, and welcome to Central Ward Conversations. Central Ward Conversations is our platform where we talk about the different issues that affect the city of Newark, specifically in the Central Ward, and we get a chance to speak to the people in the different departments and services that run our city. Today, we are really honored and blessed to have with us the director of the Department of Health and Community Wellness, Director Ketlin Baptiste Alsbrook, and the Director of Homeless Services, Director Louis Alario. Welcome.
Thank you.
To Central Ward Conversations. So, first of all, let me just clarify. Now, the Office of Homeless Services is under the Department of Health and Community Wellness, correct?
Yes.
Okay, now when did that happen?
So that happened in March of 2025.
Okay.
Mm-hmm.
All right.
We're happy to welcome them back.
Yes.
We really appreciate the support. Director Alsbrook has an incredible infrastructure in the health department that she's built, so we're benefiting from it directly, and has allowed us to do more of the work on the ground.
So now, has it changed the services, the programs being under the Department of Health? Has it changed anything regarding homeless services, how you perform your duties, or?
No, I mean, the vision still remains the same.
Mm-hmm.
The mayor is locked into this issue, is putting a lot of pressure on us to do this work, and we're here to support his vision and continue to serve the public in our capacity. So nothing's changed. The vision is still there. The services are still moving forward.
Okay, that's great. So, Director Alsbrook, tell us about the Department of Health and Community Wellness, and what is it that you do there?
Sure. So the Department of Health and Community Wellness is the public health arm for the city of Newark. And we're unique in that we also have a co-affiliated federally qualified health center. So our focus is not just on preventing disease and illness, but also treating disease and illness, which I think is an amazing marriage and benefits the residents in the community that we serve.
Okay. And what health services are available to Newark residents through the city, and is there a cost or a fee?
So the Department of Health has a pretty expansive portfolio. So we provide everything from immunization services to make sure our little ones are properly vaccinated, WIC services so that we can provide families with nutritional counseling, breastfeeding support, as well as nutritious foods in order to prevent food insecurity and give them the opportunity to raise children that can thrive. We also have our amazing lead exposure prevention program, which provides nurse case management to children who've been exposed to lead paint hazards in the home. Obviously, we're an older city, so we have a lot of housing stock that is built before 1978. And so we are able to provide nurse case management services to the children, environmental investigations to identify the source of the hazard. And then we have grants, federal and state, that allow us to go in and provide remediation and abatement support so that we can eliminate those hazards from the home. We also provide health education. We think advancing the health literacy of our community is very important. Not only does it help them to navigate this complex healthcare system, but it also supports their ability to advocate for themselves and to adopt healthy behaviors and practices that will improve the quality of life that they have. And I'm very proud of our federally qualified health center. We provide adult medical care, pediatrics, oral health care, everything from cleanings to dentures to extractions. We even have a denture program that allows us to provide assistance to those who are underinsured or uninsured. They're able to get dentures and pay for what is often a costly procedure over time at a very discounted rate, making it very affordable for them. And within our FQHC, we also have women's health and behavioral health as well.
So all of these services are free of charge?
I didn't even get started. I mean, we have a lot of services. And I wouldn't say free of charge. For example, in our FQHC, If you come in, we do a determination of what your insurance status is. If you're insured, then obviously we work with your insurance provider to cover the cost of services. If you're uninsured, then we look to see if you're eligible for Medicaid or any insurance that's available through the marketplace, for example, and we support you in enrolling and gaining those benefits. And if you're not eligible for any of the insurance packages that we have, then we have uncompensated care dollars that allows us to provide those services at very minimal cost. We employ a sliding fee discount, and so depending on what your income level is, you may have a nominal copay of $10 if you're below federal poverty level, and it increases incrementally by about $10 or so, so that even at the most, someone who's making less than $40,000 a year can receive full primary care services for under $100.
And this includes general practitioner, general medical services, as well as the dental services?
That is correct, yes.
Oh, wow. So how does someone make an appointment, or do you take walk-ins? How does that work?
Yeah, we prefer appointments, but we do take walk-ins. So if you're interested in seeing one of our providers, you just call our 1-800 number. It's 1-800-734-7083. You can make an appointment that way. And we also, like I said, accept walk-ins as well. We offer services during non-traditional hours, so we have late nights within each of our practices, and we open on Saturdays as well, first and third Saturdays of the month, so that we can support those who may not be able to come in during traditional hours.
That's great. And what's your address again?
So we have a few locations. So our main location for the health center is 394 University Avenue. The health department itself is located at 110 William Street. Our environmental services are at 94 William Street. We're kind of like three different complexes side by side. And then we have a school-based clinic at Speedway Elementary School, which sits on the South Orange Avenue corridor in the West Ward.
That's huge.
Yeah.
Yeah. So
And I have to mention our medical mobile units.
yes.
So we have 3 medical mobile units and a dental mobile unit, which allows us to go into communities and provide services to those who are most vulnerable or who are not able to make it to our brick and mortar locations.
Now, I've seen the mobile units at different events. The mayor does the Occupy the Block, bringing city services to the community. And so, we've seen it as so many different, the mobile unit gets around more than anything. Anyway, I know is seeing more festivals and more community events. Do you see an increase in numbers for people coming to the mobile unit as opposed to going into the office?
No, we get more of our volume in the office, but we're able to use, as you mentioned, the mobile units at health fairs and community events, but we're also able to partner with schools so that children and parents don't have to take a day off from school or miss school and come out to get vaccines or get a physical in order to participate in athletic programs or that sort of thing. So we work with our school partners to bring those services to them so that children are able to access our services without having to miss a day of school.
That's a great service. And how long have you been working with the health department?
So I've been with the health department for 25 years, but I've been in my position as director for the last 4 years.
Excellent, excellent. One of the best things that May Baraka could have done, made you the director.
Thank you.
And so, Director Hilario, homeless services, we know that homelessness is a huge issue, not only in the city of Newark, but in every urban area. It's just something that's growing, and it seems like the more you try to tackle it, the more issues arise. So how long have you been in this role?
Just a little over 4 years, actually. I was appointed back in early 2022.
And so describe the services that are provided in your Office of Homeless Services.
So the mayor recognized that we needed a dedicated office to really address this really complex issue. So he created the office in early 2022, around the same time that I was appointed to lead it. And so in addition to that, he also asked that we, develop a strategy around addressing particularly our most chronic homeless individuals in our city. So that was an important part of this response, is the mayor asking folks to call to action, come together, let's kind of respond to this together. And I think that is what the culture is in the city of Newark, of collaboration, bringing all these partners together. And that's been very impactful. The Path Home, collaborating across our community, was launched with our partners in late December of 2022. And it really has provided a blueprint and a guide for us as a community in responding to this issue. So our office uses the Path Home strategy as a guide. In addition to that, we collaborate with our public-private partners. We coordinate resources and services, and also oversee programs and services and really special initiatives that the mayor tasks us with.
So, with homeless services having to deal with so many unsheltered Newark residents, you also have to deal with people coming in from other municipalities, people being bussed in, people being dropped off.
Yes.
How do you deal with that when you already have such a Herculean task of dealing with homeless residents that are Newark that are Newark based, and now you are trying to assist people from everywhere else?
Yes.
How does that work?
It doesn't. It is really tough. But the first thing we do is that we do answer the call. So, for example, just recently, during these really frigid temperatures, our first goal was to bring people indoors, right? Regardless of where they come from, right? At one particular night, we brought in close to 70 people.
Wow.
We also had to dispatch a casualty bus, in partnership with OEM. That casualty bus alone brought 13 people together, right? But we do know that folks are coming to the city because of what the mayor has, developed here, our really strong homelessness infrastructure. Unfortunately, that is not the case in their communities, right? Those services are not meeting their need, they're not sufficient or absent, right? But part of our job too, which is something that we are working really hard on, is diversion. So figuring out where they're coming from, right? Having a guided conversation and connecting them to those homeless systems in their communities. It is not easy to do, but it's really something that we have implemented going forward.
So tell me about, you mentioned about the this recent frigid weather has been brutal.
Yes, it has.
And the mayor activates a Code Blue. Tell us about Code Blue. Tell us about Code Red.
Yeah, so the Director Alsbrook in partnership with the mayor, when the temperatures reach a certain temperature, it kind of announces a Code Blue, initiates a Code Blue, and basically that is a response for us to come together and really engage our most vulnerable. We have actually struck an emergency declaration to open up a Code Blue Center at the first floor of the YMCA that offers 50 cots. In addition to that, our street outreach teams are expanded, right? So we have more vans, more folks on the ground. We also, our existing shelters are expected to expand their capacity as well to make sure that we're bringing. So it is like an all community response. It is, directly led by the mayor, the health department, and the Office of Homeless Services, and it's really critical, especially when we experience a weather emergency.
And Councilwoman Bay, not to
Yes.
interrupt, but I just wanted to add, this winter has been very significant, right?
Yes.
We've had over 70 Code Blue days this winter season, and we're barely into February.
Is that a record? I feel like that's a record.
It's a record for me. I
think that's a record.
I think that's a record.
Yes, I think that's a record for us.
Yeah, definitely.
Yes, it's been, but the blessing is that we have you and your teams to respond to people in such an efficient and effective manner. And basically you help keep people alive.
Yes.
You keep people alive, and that is major, that is huge, and I don't think people really understand the severity of the work that you do. So I just want to first of all thank you for all that you do. And you mentioned the outreach team. Tell us about the outreach team, because people aren't always ready, willing, and able to just meander into a shelter, because there's a lot of reservations. People have had negative experiences and they're afraid, and we have substance abuse issues and mental health issues. So that great group of people that you have going out into the community, tell us about them.
Yeah, you said it right. They're great people with big hearts, and first and foremost, they're building relationships. That's what they do. And when I get an opportunity to ride with them, they know folks by their first name, right? And to me, it's like, wow, that's really, it gives me goosebumps, because that tells me that they're actually having intentional conversations with our residents. And that is part of building that relationship and that trust. So we can then at one point, right, hopefully move on to the next step, whatever that pathway may be. Right. But the street outreach program is really one of the mayor's really signature initiatives. Just about a year ago, we actually expanded it 24/7. We also added a behavioral health component where we pair our street outreach workers with psychiatric nurse practitioners, social workers, drug counselors. And again, that was in response to just some of the high rates of behavioral health disorders that we see on the ground. Not one of the main reasons, but some of the reasons why folks are experiencing homelessness. And we also recognize that we can't be everywhere. So we asked the public to help us as well. So the mayor launched a Path Home text alert, where you can text the words Path Home to 855-11. That then gets sent directly to our outreach teams, who then respond to the individual.
And so respond, meaning they come and pick them up, or they come and talk to them? Do they bring things to them?
All of the above. I mean, our ideal response would be that they come with us, but that's not always the case.
Yes.
It might take several times before the person says, yes, Lewis, I'm ready to go. During the peak of the storm, we actually had a text alert, and we responded to a location where there was a senior sleeping in a car that wasn't turned on because he ran out of gas. There was a concerned resident who sent in the Path alert. We actually, that time I was with them, we approached the vehicle. I didn't think anybody was in there of how cold it was. He actually emerged from the car, and I said to him, hey, listen, a concerned resident reached out to us. We're here to help. He's like, well, I'm on my way. And we were able to bring him in and actually place him in shelter that night. So it's really an important part of engaging the public, because we can't do it all. And we really appreciate the partnership.
And I would add that, because the winter has been so brutally cold, even the daytime temps are ridiculous, right? Yeah. And so thankfully, we've been able to work with our partners, drop-in centers, so that when the overnight sheltering ends, we can transport them to a drop-in center where they can continue to get some reprieve from the cold weather.
Yeah.
So I wanted to ask you about the connection between working with our unsheltered population and the medical services provided at the health department, because a lot of people, they don't realize that, if you're without a home, if you're out in the street, in the community, you may not know that you have high blood pressure. You don't know that you have diabetes. And if you are able to get medicine, you're not aware of the times that you may need to take it. And so we have people that fall into all kinds of different illnesses and issues. How do you make those connections? How do you help them? How do you bridge that gap?
Yeah, going back to your first question about what has changed now that Homeless Services is back with the health department, I would say that there's better integration and better access for our residents without addresses. And, we've been doing this work for quite some time. Our first designation as an FQHC was specifically for meeting the needs of residents without address, our homeless population. And over time, we expanded that to be able to provide these services to everyone. But with that said, one of the benefits of receiving services through our FQHC is that we're also able to provide wraparound services that enables individuals to access medical care without barriers related to transportation, as an example. So we can provide transportation assistance. We provide medication assistance. So
medication assistance.
Yeah. So if you're uninsured or underinsured, and you see your primary care doctor and they prescribe you a medication, but you don't have the funds to pay for that medication, we will cover the cost.
That's
there may be,
changer.
For most individuals, there's a $7 copay, regardless of the cost of the drug. And for those who really do not have the means, we can work with you to waive that copay amount. But we want to make sure that you're receiving primary care, that you're being as proactive about your care as possible. And if that medication is what you need to manage a chronic illness or a disease, then no problem. We got you. We will support you in that effort. We also provide support with laboratory testing. And so, with any management of disease, you have to be able to look at your labs on a regular basis. Your doctor needs to be able to look at your labs on a regular basis, and that comes at a cost, unfortunately,
Yeah.
when you're uninsured. And so we provide that service as well through a contract that we have with LabCorp.
That's excellent.
We also partner with the health department's community health workers often. They're sort of like the equivalent of our street outreach workers, where they're community centered, community based. So there's a lot of coordination between those two teams and groups, and we also started looking at how to better integrate the FQHC services into our housing programs as well, and that's been so far very successful. So we're excited about that.
Yeah, we're bringing behavioral health services directly to those who need it the most, which is very important.
Okay. So one more time, I want you to give out the phone numbers so people can call. So let's start with Path Home.
Sure. So there's actually several ways. I had to write them down. That's
Okay.
because one of our goals is to make sure that we have several entry points to the system. But we are located at 110 William Street, but you can also contact us at 973-877-9481. I do want to give a shout out to Newark Emergency Services and our other drop-in centers, because that is another way for you to access our services. Over the last year, we've empowered our drop-in centers to make emergency placements, and it's been super successful. Our drop-in centers have done over 1,600 emergency placements directly from their centers, so we're really proud of that. We also have a street outreach hub on 189 Market Street, where we're centered. Our outreach teams are centered and are based out of. So if you're in the area there, and if you know somebody, you can always send them there. And then finally, if you're not able to go to any of those places, but you do see someone that needs non-emergency services, you can text the words PATH Home to 855-11. Thank you.
And phone number for
Health Center, 1-800-734-7083. But we take walk-ins, so
Yes.
one come all.
I just want to thank you so much for your time and for giving up so much information. So again, Director Ketlin Baptiste Alsbrook from the Department of Health and Community Wellness, Director Louis Alario from the Office of Homeless Services. I want to thank you, and I want to thank you all for watching and for tuning in. See you next time on Central Ward Connections.